SOMAS is a digital surveillance tool which facilitates real-time reporting of cases of epidemic-prone diseases, including COVID-19, by health workers across states. To tell us how this helps the battle against community transmission, we have joining us from Abuja studio Dr. John Oladejo. He's the Director of Health Emergency Preparedness and Response Department at the NCDC. Thank you for joining us on the program.
Thank you.
So SOMAS means Surveillance, Outbreak Response Management and Analysis System. How does it work, especially in the COVID-19 fight?
SOMAS, as you rightly said, is an open source of a mobile health system that actually processes disease outbreak as well as management of the cases that are actually coming in, through digitalized surveillance system, both at the facility as well as the laboratory. So how it works is that we were able to actually deploy this software to all the borders as well as all the state of the federation. So this is a real-time collection of data. So as the case is occurring and is being entered into this software, we are actually receiving it from our office, and all the pillars have the opportunities to actually view it too, and then take necessary decisions. So this is exactly what we did. As the as the cases are actually being imported into the country, we are, seeing it, and then we are taking prompt response to ensure that we contain it. So this is how it works. The software works all over the country.
Okay, I was going to ask how indeed it helps with ramping up testing, scaling up testing, because I know that SOMAS was also used during the peak of Lassa fever and monkeypox in 2018, but then it was just in a few states.
Yes, during this COVID-19, we were able to deploy SOMAS to all the states of the Federation now. We have our health workers, our data manager, as well as our surveillance officers in all the states of the Federation. And then we have equally trained health workers at the state and the local government level. So we have it in strategic places where the data have been entered as it occurs. So this has actually helped us to really follow up cases with the case management modules. We follow up the contact with contact module, and we equally follow up the results to link with the software in all over the countries where we have this software. And this software is hosted in our office in Abuja, Nigeria Center for Disease Control, and is linked to all the public health emergency operation centers throughout the Federation. So each state has its own password, and they can view what is happening in their state. They will be able to take necessary measures to ensure that they actually contain the disease. So this is how we are able to really get all the cases, all the contacts, and all the results that we are getting from the laboratory to be processed, and then link up with all the pillars, and they will be able to take opportunity to act immediately.
Just quickly, before you go, Nigeria is still far from its goal of 2 million tests. What has been done to reduce turnaround testing time and conduct more frequent tests on the population?
So the first thing we did was to increase the number of molecular laboratories all over the country. And then we now deploy SOMAS to each of these laboratory with health workers, data managers that are actually working with them. So with this, we'll be able to really follow up each case as it occurs, and then link it to the result, and then ensuring that all the necessary pillars take necessary step on it. So with the number of molecular laboratory, we are equally scaling up testing in all the local government of the federation, as rightly said during the interview with one of our colleagues in Adamawa State, because there have been a decline in the number of tests, but efforts are on top gear now to ensure that we increase the testing capacity by ensuring that we increase the sensitization at local government and even at the community level. So within a very short period of time, the number of tests that will be conducted in each of the local government will increase, and this one will show that we need to have at least 1% of the total population, which is 2 million. So by the time we reach that level, we'll be able to know, yes, the status of COVID-19 and know whether we are actually flattening the curve or not.
All right. Well, I appreciate your time. Thank you so much, Dr. John Oladejo, Director of Health Emergency Preparedness and Response Department at the NCDC. Thank you for joining us on the program.
Thank you for having me.
We have more on the global response to COVID-19 when we return. Please stay with us.